Health Workers Union, HAITU, is calling for the insourcing of all security workers at Gauteng Health facilities. The union says that private security companies are being used to loot the health department. Joining us now is Mthunzi, General Secretary of the Health and Allied Workers Indaba Trade Union. A very good afternoon to you, ma'am. Grateful for your time today. So you're making the case for insourcing. On what grounds?
Good evening to Begila and good evening to your viewers. We are making this bold call on the grounds that since early 2000, more than 23 years ago, the Gauteng Department of Health took a call to try. Initially, it was a trial to see if insourcing would be far more effective than the insourced security services. Obviously, by now we know that's definitely far from the truth. Around 2016, the Department of Health had not even been able to renew the long-term tender processes or contracts. As a result, you can imagine for more than 7 years, the department had been running at a whopping 59 million bill month on month, paying different service providers that cannot guarantee the safety of patients, cannot guarantee the safety of healthcare workers, especially as well the safety or even the security of our health facilities. So that's why we are boldly saying the call to insource so that there is direct auditing, there is direct control by the department itself in this particular services which are so crucial, especially at the backdrop that majority of our healthcare workers are female who are vulnerable to attacks on a daily basis, assaults and so forth. So we do need our healthcare facilities safeguarded by people who are qualified, who are experienced, who know exactly what they need to be doing, and they can account.
So the people you are suggesting be outsourced as government security workers then are not adequately qualified, adequately resourced. Would that be an additional cost burden on the government to now make sure that they are properly resourced, they are more or better trained?
Look, there's no additional cost that we are requiring. Remember, like I'm saying, historically, even in fact in more other provinces, security are employees of the Department of Health. There is no justification, none whatsoever, except the fact that these hefty contracts that are short-term are benefiting a certain few individuals, hence they must be kept. So there's no additional cost simply because there is already funded posts. So as we're talking, we are outsourcing security, but in a hospital like Baragwanath, we still have few of security guards that are still from the employees of the department, but they are not actually being effectively utilized. So we are saying insource all of them so that there is direct supervision and there is direct accountability on the security personnel.
And you've said that the lack of resources and inadequate training can be linked to high incidence of crime at hospitals and public clinics. Are there actual examples that you can give us where it's been proven that it was because of those two factors that there was indeed a surge in crime?
Definitely. I think what is quite crucial is the fact that most of the security that are currently those month-on-month contracts will tell you that they don't even have a baton or a teaser. They don't even have anything, and some of them are not adequately to even have backup of armed response should it actually becomes bad. I mean, we've seen incidents in Helen Joseph where a healthcare worker around 4 a.m. was stabbed whilst in the line of duty. That should not happen if the parameters were well patrolled and the entrances were properly closed. So it's our hospitals and clinics are thoroughfares. And majority of our clinics which reports high escalating incidents is because we are forcing healthcare workers, or we want, ideally that our health facilities should be run 24 hours, but that's not practical because of those scares and those attacks that our facilities are getting. The CM Judge case is a classical one where a big hospital that is servicing so many people gets to burn and no one knows what happened, and also continuously becomes looted, equipment gets lost, and there is security there is men that are supposed to be there, and the booth are supposed to be able to patrol these parameters, but we are not able to do that. As a result, CMJ continues to operate partially. Rahima Musa again is one of the most hardest hit, and the excuse is always they're saying this facilities are around areas that are gang, there's a lot of gang-related violence. But that is the more reason why we need that our securities must be beefed, they must be backup, and they must be insourced with proper training and proper equipment.
And how would you want to see the insourcing work if it were to happen?
I mean, definitely we are not oblivious to the fact that it must be done gradually, but a clear plan needs to be put in place. And number one, I think the political will must be there to say this is the strategy that we're going to employ, but immediately the willingness must be definitely there. I think the previous administration did commit to say the insourcing that had already started in the west in the west of Gauteng needs to set up a pace and must be fast tracked. We are worried that this has already now taken a backseat, and we are now talking about renewing contracts that could not actually be renewed, or tenders that could not actually be endorsed on two occasions because of issues of irregularities that are picked up, that certain individuals want to benefit from this particular tenders. And they've already promised names of security personnel and security companies that are going to already benefit no matter what time and when the tenders come out.
Well, the contract for security services in Gauteng at health facilities has now been re-advertised, as confirmed by the Health MEC to us here in Newzroom Afrika as well in the week. Are you going to actively oppose that as a health workers union?
Absolutely, definitely. We are saying the intentions of the MEC are not honorable. The MEC is actually ill-informed and misguided by a department, because those officials that are in the department have a tendency, and this is something that we've been saying the most, to mislead every HOD that comes in the Gauteng Department of Health and every MEC, because they are aware that they are clueless. It's worse with our current MEC, who has got absolutely no acumen, no experience or knowledge of how the department works. This, for her, it will be definitely a wrong move, something that has been opposed before. HAITU will definitely be opposing this vehemently and making sure that this does not see the light of day. Instead, we are demanding that workers must be adequately resource trained and be employed permanently.
Mthunzi, thank you so much for your time. General Secretary of the Health and Allied Workers Indaba Trade Union.